Taking care of our mental health is a super important topic and thing to do, and something that we rarely talk about, especially in Germany. We've known a few internationals and Germans who have struggled to navigate the system to find the help that they need. So we decided to create this video, to record this video, to provide some possibilities if you are seeking help. Finding the information for this video was not easy because there's very little information online. So for this, we reached out to an expert, which is a licensed psychologist who's called Nina Löwen. Did I say that right? And she was so kind to answer all of my questions and help me with the process of the research of this video. So shout out to Nina. In this video, we will talk about, does your health insurance cover therapy? Why is it so hard to find psychologists in Germany if you're publicly insured? The ways to find a therapist in Germany, 3 real-life examples, and emergency hotline numbers. Hey, my name is Jen and I'm from Guatemala.
And mine is Yvonne and I'm German.
And together we're from simplegermany.com, where we create English content to empower internationals to settle into life in Germany more smoothly. The first question is, does your health insurance cover therapy in Germany?
In this case, the answer is generally speaking, yes. However, the type of therapy that is covered by your health insurance depends on the type of health insurance you have. If you have private health insurance, you need to look at your individual tariff because there is no one tariff fits all. And it really depends on what you chose to include in your tariff. I know tariffs that don't include it. I know tariffs that include it, but with like a higher copayment of, let's say, 20-30%. And I know there exist tariffs that include it fully, 100%. If it is included in your private health insurance tariff, you have a lot easier and faster access to therapy because there's a lot more psychologists out there in Germany that cover privately insured people only.
If you're publicly health insured, then the answer is yes. Your public health insurance will cover therapy in Germany. However, this is where the tricky part comes into play. Actually finding a therapist that is covered by the public health insurance is tricky. Sometimes waiting times is up to 6 months, which leads to the second question of why is it so hard to find therapy when you're publicly health insured in Germany. In the conversation that I had with Nina, she explained that in Germany there is an X amount of open slots that are available for licensed therapists to apply to be able to have their services covered by public health insurance. This number was set in the 90s, and it was based on the demand back then. However, the demand has increased, but these slots have not, so it's like a capped amount. And currently, she explained that a licensed psychologist or therapist needs to wait up to 8 years to be able to enter the system.
Wow, so in this case, it's really the German system that is totally out of date.
Yes.
And not the fact that psychologists don't want to provide services to publicly insured people.
No, so actually it's saying that there is an abundance of therapists, it's just not an abundance of slots in the public health insurance to access these therapists.
Oh, wow. Okay. I was not aware of this.
So that is really crazy. And then what do you do, right? Because Nina was explaining as well that public health insurance needs to cover anything that has to do with your health. And if you can prove that the system is broken, so to speak, that you were not able to access a therapist through public health insurance, you can go to a privately health insured psychologist or therapist and then claim the money back from the public health insurance.
Okay, but of course it means also jumping through more bureaucratic hoops again.
100%. And the word for this, because you're German, I'm going to let you read it, is
Kostenerstattungsverfahren, which it is totally out of scope of this video to go into detail on how to do this process. However, Nina was so kind to send us a written guide from another licensed psychologist going into detail on how to proceed with this step. So pretty much what we're saying is, yes, it's covered. You can seek help. If it's impossible for you to prove, or if it's possible for you to prove that it was impossible to find a publicly licensed psychologist, you can access a private one and then claim for your money back by filling out a bunch of forms, most likely.
Yes. Now, don't feel ultra discouraged because it's not impossible to find a therapist that is covered by public health insurance. It just might take time. So it actually highly depends on the urgency of your situation. And if you do want to go through the public health insurance route, this is the way to do it. Step number 1 is call 116-117, and you need to ask for a psychotherapeutische Sprechstunde. And the way I understand it is that they will set a call where a licensed therapist who is covered by public health insurance will give you a call back and will kind of like do an assessment in an hour. I can imagine that they ask questions and want to hear your situation. And based on this conversation, they will provide tips on the kind of therapy that you might need, how urgent it is, how many sessions, and so on. After you've gone through this process, then you need to fill out a form, which is the PVT 11, if I'm not mistaken. Actually, it's PTV 11. You need to fill out this form and then hand it in to your health insurance. Nina also says that some psychologists accept this form and they file it for you. So you need to like check. But then you need to go to step number 3, which is finding a therapist. And that goes to the big question, where do you find therapists in Germany?
What is super important to know here is there is different types of therapy. Hence, there's different types of therapists. And here it's really in the nuances of the words. And if you are actively seeking for medication, then you do need to consult with a psychiatrist, because they are the only ones in Germany that are actually allowed to issue and prescribe medication.
Yes, and this medication most likely will be covered by your public health insurance with a small copayment. We will go into details of how this works in one of our 3 life examples, which is later on. So let's jump into ways to find therapists in Germany. The first option is to go to therapie.de. Nina mentioned that most of the colleagues that she knows and herself, they're listed in therapie.de, and it's a big database of all kinds of therapists in Germany. The cool thing is that on the left-hand side, you have filters where you can also filter therapists based on your language. Now, be careful here, she said, is that because anyone can pretty much list themselves there, and in Germany it's very common to have coaches or Heilpraktiker, which are translated to
alternative medicine,
healers or something like this, and these are not covered by public health insurance. The public health insurance only covers licensed therapists. So if you see the words of Heilpraktiker, or there's another word that they say, psychologische Beratung, which is psychologist consultation, then it's most likely that they're not licensed. You can, of course, always reach out to them and ask, hey, are you licensed or not? And they will be honest and tell you yes or no.
So not to discredit any of the professionals that offer coaching or are Heilpraktiker, and you can totally go with them if that's, the type of care you'd like. However, the only thing we want to point out, they will not be covered by public health insurance because they're not officially licensed.
Yes. Second option is to use Dr. Lib. Dr. Lib is an app in Germany that you can download on your smartphone, and there you can filter therapists also by the type of therapy that you want, whether psychologist or psychiatrist, for example. And you can also use their language filters to find. I think in Dr. Lib, it's a super cool app. However, I would say it doesn't have maybe a big amount or the same amount of available therapist and therapie.de.
Yeah, because Dr. Lib is generally for all doctors. We've talked about it in a bunch of videos about general healthcare in Germany. So I agree with you, the focus is not on purely therapy.
Yeah. And the same goes for another platform, which I found super cool, and it's called QueerMed, which is kind of like Dr. Lib, but it's not an app as far as I understand. It's a website that you can look for LGBTQIA plus friendly doctors, not only therapists, but doctors in general all over Germany. I would say also their database is probably not as abundant as therapie.de, but if you're looking for a specific LGBTQIA plus friendly doctor, that could be a cool place to look for.
A fourth option, with Nina pointed out, which also for her is a little bit like the underdog and most underrated way to find a therapist, fast also ideally, is to look at so-called Ausbildungsinstitute. So pretty much institutes for apprenticeship for further specialized studies of master psychology students. So while they're specializing in an area, they have to offer at least 600 hours of therapy to real patients. And those patients must be publicly health insured.
One thing Nina pointed out is that a lot of people is like, ooh, people in training, I don't want to do that. However, you need to remember these are master psychologists. So that means they've already had at least 5 years of studies. And they're very closely supervised, and they use the most recent evidence-based training that is out there in the market, so to speak. So it's super high end in that sense.
And they're motivated because they want to reach the certification, right?
Exactly. So it's super underdog and underestimated option that maybe a lot of people actually don't know exists.
And what is a good way to look for these Ausbildungsinstitute?
Very good question. I would say Googling or searching on your browser of choice, Ausbildungsinstitut and the name of your city.
Plus psychologists.
Plus psychologists as well. Another way is to go to university, write to university or call university clinics, which they might also have a Ausbildung Institute. So here, I think it would need to be a little bit of research depending on the city that you live. And I guess the bigger the city, the more Ausbildung Institute that they are, for sure. Now, the fifth option, which is leaving the system a little bit, and that is paying from your own pocket. And Nina was explaining that in Germany, therapists can charge between 100 and 180 euros per hour. And this tariff is regulated by the government. So they have like a tariff sheet that they can have a range. To be completely honest, I don't know if it's possible for licensed therapists to charge more than that. Sometimes in TV, we see that it's like 1,000 euros to go to a therapist. I don't know if they're coaches or licensed therapists. I'm not so sure in that sense. But anyways, but Nina said anywhere between 100 and 180 euros per hour, it's a good ballpark to estimate.
And the sixth option, depending on the help that you're seeking, is to also look for a licensed therapist, or any therapist for that matter, in your home country to do video calls, maybe also in your mother tongue. Platforms like BetterHelp have also surged, I would say, through the pandemic. Yeah. So that is definitely also an option if that makes you feel more comfortable, and maybe is a little bit also more budget friendly than Germany. Depends on where you come from.
Yes, and this option is again paid out of pocket because no health insurance is going to pay you if you're looking for help outside of the country.
Yeah. If you're liking the content of this video and it's providing value to you, then please be sure to also give it a thumbs up and subscribe to our channel for further updates. And if you would like to join our thriving online community, then be sure to check out simplejoin.com/club.
Now let's jump into our 3 real-life examples. Let's start with an anonymous. We're going to say these all anonymous, so to protect the identity of people. And this person is an international living in Germany with ADHD, and they were looking to get a diagnosis and medication for ADHD. So first of all, in Germany, this is called ADHS. So they struggle to find a psychiatrist. Remember that psychiatrists are the only ones who can prescribe medications in Germany, and they wanted medication. So they struggled to find a psychiatrist who was accepting new patients, spoke English, did the ADHD assessment, medicated for the ADHD assessment, because apparently there's doctors that only do the assessment but don't do medication.
With assessment, you mean diagnosis?
Diagnosis, yeah, the diagnosis, and that's it. Those were already pretty strong criteria. So what they ended up doing is through Dr. Liv, they found a licensed psychiatrist who was able to do the diagnosis and prescribe medication, and they paid out of their own pocket. They paid 600 euros at the time of recording. This is 2024, and they required 4 sessions to get the diagnosis. They were kind enough to provide their experience. They wrote it down and were comfortable enough in sharing their experience on a Notion page that we have publicly open, which you can check out in the link in the description below. If you would want to read a little bit more of the experience and how the process works to getting the ADHD diagnosis and medication. Going back to the story, the medication is being covered by the public health insurance, even though they paid from their own pocket. And this one, they pay 5 euros per box as a co-payment.
As a second example, we have an international living in Germany who was looking for a bit of a long-term therapy to help battle and find tools to manage stress. They are privately health insured. We don't have the details of whether their tariff covers any therapy or not. However, the main priority here was, I believe, the mother tongue, which is Spanish. So they opted to look for a therapist in their home country and have weekly video calls to just, talk things out.
Yes, and for them, they're paying out of their own pocket. However, I think the price is a little bit cheaper, if not way cheaper, than the regulated price that we talked about in Germany.
And the third real-life example that we know of is a German who's struggling with depression, and they were able to manage to go through the public health insurance system, however, with encountering the before-mentioned waiting times. It took them around 6 months to get the therapy that they were looking for.
And a lot of forms.
However, they did manage to get that help.
Yes, and they successfully got therapy, and I think they're still continuing to therapy. It was a long-term process as well. Now let's talk a little bit about emergency hotlines. If you're ever in a situation that is an emergency and you don't know what to do, these are 3 hotlines that could help you. So the first one is called Telefonseelsorge, which I'm not so sure if you need to speak German to call them, to be honest.
So I would say it depends highly on who's on call, right? Telefonseelsorge is a hotline pretty much that is available 24 hours for anywhere in Germany. And what they do is they not only guide you in seeking the right help in the moment that you need help, but they also actually take care of you as the caller to support you, to calm you down so that you are actually able to help the person that you're calling for in case you're helping someone else and not yourself.
Yeah.
I hope that makes sense. And I would say it really depends on the person that answers whether they speak English or German. There's no guarantee, but one can always ask. And since they're trained to guide and support, I could imagine that they make an effort or at least try to help you somehow in the situation that you're in.
Yeah, fair point. Another hotline that actually Nina shared with us, and that is specialized in helping women. And this one, she also says it's available in English, and it's called Frauenkrisentelefon. We're going to leave the links of these websites also in the description below. And here we have no experience. This is just a resource that she shared. And of course, if it's a life or death situation and you don't know who to call and it's an emergency, then you can always call 112. The personnel answering the phone calls will know how to guide you and exactly how to handle it and do what they need to do. Mental health is still, unfortunately, a very taboo topic in Germany. However, we believe it's super important to talk openly about it. The person that shared their story about getting diagnosed with ADHD shared how important it was for them to feel empowered and supported to take the decision to look for help, because actually looking for help has changed their life completely. They see the world in a completely different way. So if you're struggling with any of these issues, then don't be scared of looking for help. Help is out there. It just unfortunately requires you to take action to go and get it. And in this case, I would say the German system is not the most supportive. However, if you fight it, like a monster, you can definitely achieve it. We know this is a very sensitive topic for a lot of people. However, if you're comfortable sharing your experience in the comments, we would love to read them. And I'm pretty sure it will help others who read them as well. Until next time,
Tschüss!